Hello, welcome to Zion Extra. Our topic for this program is the popular side. Just to let you know, my name is Alex Oni Edigan. In regard to the COVID-19, everyone knows about that. It's killing, distracting, increasing in anxiety. So now let's talk about the clinical side activity and for you to learn to educate yourself, educate your family about the COVID-19. And we're going to be talking about coronavirus, just kind of overview in regard to the history and coronavirus impacts, challenges, and how to manage coronavirus. I would like to start with the word SARS. SARS is severe acute respiratory syndrome. Is an infectious condition that can cause serious respiratory illness and sometimes lead to death. However, this SARS became a concern in 2003 when there was the same outbreak in China, spread worldwide, also caused global epidemic. SARS is caused by actually coronavirus, the same family of viruses that causes some common cold like most respiratory viruses. SARS appear to spread from person to person. We all know through coughing, sneezing, and also close contacts. Symptoms of the infection since during 2003 outbreak, 2003 outbreak, include similar to what we are seeing today when we are talking about coronavirus, such as flu, fever, cough, chills, and chills when I mean chills like cold, and shortness of breath, headache, and diarrhea. These are some of the symptoms that were seen in 2003, during the outbreak of coronavirus. This time, the infection spread rapidly, just like the way we are now. This includes seclusion of all healthcare workers, people in community, banning people from coming to public places. Yes, just like what we're having now. It was actually a little bit more serious because now we only had death and death and death, but every country we're having issue with the same issue in 2003. You ask, how do you transmit, how do people get affected with this severe acute respiratory syndrome, coronavirus, I'll call it SARS, is an airborne virus, which means it's spread in a similar way to cold and flu. Yes, similar way to cold and flu. So virus spread in small droplet of saliva, cough or sneeze into the air by an infected person. If someone else breathes in the droplet, they can become affected. Yes, when someone sneezes and you breathe in the air when the person, or is on the floor, just the same way when we're talking about this coronavirus. Yes, the same way it also spread. I'm just kind of taking you back from 2003, because a lot of people is thinking coronavirus just came out. Oh, no. It's always important we educate ourselves and understand when things like this are happening, when it comes to diseases like coronaviruses and all that. This will reduce anxiety, because if you ask me, if we're talking about 2003 now, that means why is it coronavirus? Why is it, is it existing before and we people were not aware? My advice is that just be careful, because a lot of people must have had this recent diagnosis for many years or many months before the media start talking about it. Before the incident we had in is it Wuhan in China. So yes, we just need to be careful, because to me, coronavirus has been, a lot of people already have this coronavirus. A lot of people must have gone through coronavirus, because some of the symptoms that we are going to be looking at in a minute, you find out that they are all similar to the coronavirus COVID-19 that we all are talking about. Yes. What are the causes of coronavirus? The fact that I've just explained that when we're talking about severe acute respiratory syndrome, this thing is members of the coronavirus family. Coronavirus viruses, which we are aware that it's of different family, different viruses, and depending on your diagnosis. But however, these same causes are still the same thing that causes the same thing, like a common cold, flu, malaria. The fact that in 2003, the epidemic in 2003 started when the virus spread from small mammals in China. Yeah, everything always lead to China. Maybe because of their lifestyle, the kind of food they eat, when someone with severe acute respiratory syndrome cough or sneeze, infected, maybe the infected droplet we spray, into the hair that goes into another person. So you can catch this if you breathe in or touch these particles that it might be on the table, it might be on someone's shirt, it might be maybe when you get into a car, like those who go and hire a car, you touch the steering. Maybe the person who cleans the car, when it was coming, I must have sneezed in the car, this thing can also be in that process. So these are what they find out. I'm talking about 2003 now. So I'm not talking about 2020. I'm still talking about 2003. So you can find out that this major information I'm giving out now has been for so long, If we look at Bill Gates, also talking about it, was it 2009 or 2019? I wasn't sure when he was talking about his idea of intervention that we need to follow or we need to quickly engage with, because he knew that if we have a virus like this that has no cure, we should be able to focus on quickly looking for treatment or something like a vaccine for people to have in order to overcome this kind of epidemic that we are having. When this thing drop, when you sneeze, when it drops in anywhere or depending on the weather, when the weather is below freezing temperature, they can live there for up to a year, and or several months. So if it's on under the surface, it can live there for hours, maybe days or whichever. But however, depending on the temperature. So if it now get transferred into human body, it only takes between 48 hours, let's say between 2 to 10 days, you, after coming in contact with it, you will now start feeling the symptoms of this coronavirus. However, there are some records that also say, depending on your immune system or depending on the environment, it's not quite sure exactly in regard to different research that scientists, doctors, and different MDT, multidisciplinary team have made in regard to how long this thing have actually been in some individual. That is what I'm saying. If we talk about 2020 now, to me, some people must have had coronavirus for a very long time, even before the media start spreading it, or before the larger pandemic that we are now, incident we have in the world today in different countries. So a lot of people must have had it for a very long time, and nobody was aware. And this is what they were having. Like in developing country where there is no test, or recently we start talking about testing individual or sign people should be noticed of. A lot of people have had this. They go into hospital, they get treated because doctor must have been thinking they've got malaria or they got a simple flu, and they must have had different concussion or having to, take some medication or keep themselves safe, isolated from other people. And at the end of the day, they get better. But nobody is really having full evidence that it has not been for a very long time, or it just started, but the media has made this thing more, everyone more aware of about COVID-19 and another. But to me, it's not just starting now. It started long time ago. Yes, it started long time ago. Because it depends on how contagious it is before, after the symptoms will appear. Now, when we look at the risk factor of this illness, as I said, there are many risk factors, but however, if we look back to between 2002 to 2003 outbreak, the evidence that was observed then shows that regardless of the age or group of people, it doesn't mean whether black or white, it was clear that some people were at increased risk during this time. This includes people over the age of 50. Some reported mortality rates of about 50% at the time. This also includes pregnant women and those with underlying diabetes, heart diseases, or liver diseases. So we are talking about chronic challenges now, chronic illness. A major risk factor is a simple close association with any person that is affected with this disease, since the virus, it can be spread when someone sneezes, spray or into hair, or coughing, sneezing, even talking alone. You can actually breathe the virus in. Some other risk factor that people need to also be aware of at this very time during 2002 to 2003 was major. Some people who recently traveled to mainland in China, Hong Kong, or Taiwan, or close contact with people who are unaware with history of travel to this area, because some people can travel now having that illness in their body or in their clothes or in the bag they are holding. Maybe their body, they have a strong immune system that is not really showing that they have this illness, so at the end of the day, when they come in contact with those who are more vulnerable, automatically that illness can start revealing signs. Group of people who are actually a bit more vulnerable are those who work in the well-being system. People like doctor, nurses, health professional, community outreach, community development workers, and anyone that work in intervention community activity. They are mostly high risk, especially those in hospitals and care homes and nursing homes. They are always on a high risk of being affected. That we are talking about employment risk. Also, we just need to be careful of our relationship at work, how we wash our hands, engaging in PPE, protective equipment that you have. Yes, it's very important. Those who work in health and social care sectors are more vulnerable. The fact that the symptoms of coronavirus, we are talking about severe acute respiratory syndrome symptoms. So it's also similar to what we are familiar with when it comes to things like fever, dry cough, sore throat, problem breathing, including shortness of breath, headache, body ache, loss of appetite, malaria, confusion, rash, diarrhea. Breathing issue will appear within 2 to 10 days after a person is exposed to this virus. That means someone with lower immune system, So the advice is for us to, isolate yourself, if someone who is presenting these symptoms or from a family who are vulnerable to being affected by these symptoms. It's very important we all work together and support each other in order for us to still have the same life expectancy in managing these challenges of disease. Some of the complications that we do experience that we will be expecting to see or observe on our patients who are diagnosed with severe acute respiratory syndrome. This may include respiratory failure, liver failure, heart failure, and kidney problem. So diagnosis and test is also very important to make sure these things are taken seriously, so that when observing this thing, the same treatment where we normally use when it comes to respiratory failure, liver failure, heart failure, and the same procedure is what every medical advice is available at the moment, but not exactly how to reduce the transfer or a cure for severe acute respiratory symptoms. Some of the tests that most professionals use to diagnose this severe acute respiratory syndrome involve blood clotting tests, chest X-ray or chest CT scan, and a complete blood count. We also have arterial blood tests. These are some of the method, the test used to diagnose severe acute respiratory syndrome. We also have tests used to quickly identify the virus that causes severe acute respiratory syndrome, which include antibody tests for severe acute respiratory syndrome, direct isolation of severe acute respiratory virus, rapid polymerase chain. If you ask if there is a treatment for the coronavirus, at the moment, there has not been clinically approved treatment or direct treatment for respiratory syndrome, severe acute respiratory syndrome. There has not been approved clinically treatment for it. However, some of the method that is mostly common in the health and social care setting at the moment are mostly isolation, where you have both the suspected, the diagnosed, that means whether positive or negative, being isolated and use a different method in covering themselves. We're talking about mask, we're talking about glasses, specialist glasses, or maybe with prone ventilation, but there has not been high level of promise that this thing has been proven by World Health Organization or Public Health England or United Nations, that yes, this is the best way to treat it. These are not treatment, it's just to separate the person, maybe giving the person some temperature, keeping the person in a temperature that maybe that could be manageable in order to see if that virus can disappear, or the person can recover by the time the immune system are able to fight. However, some of the intervention and prevention of severe acute respiratory syndrome, they call it coronavirus or COVID-19, which are somehow the same method which the Health and Social Care Organization have been using for many years. Even when we know about, if you know about Florence Nightingale, the lady with the lamb, they call it the mother of nursing. So she was one of the people who influenced Health and Social Care Organization to be engaged in the hygiene, washing of hand, and wearing disposable gloves, wiping surface, because she had really used that wiping of surface to support intervention when it comes to limiting mortality rates during the army, when they were having high mortality rates in the army camp. A lot of people were dying and all that. So cleanliness is what she was actually focusing on in the health and social care. Some of the tests that most professionals use to diagnose this severe acute respiratory syndrome involve blood clotting tests, chest X-ray or chest CT scan, and the complete blood count. We also have arterial blood tests. These are some of the method, the test used to diagnose severe acute respiratory syndrome. We also have tests used to quickly identify the virus that causes severe acute respiratory syndrome, which include antibody tests for severe acute respiratory syndrome, direct isolation of severe acute respiratory virus, rapid polymerase chain. If you ask if there is a treatment for the coronavirus, at the moment, there has not been clinically approved treatment or direct treatment for respiratory syndrome, severe acute respiratory syndrome. There has not been approved clinically treatment for it. However, some of the method that is mostly common in the health and social care setting at the moment are mostly isolation, where you have both the suspected, the diagnosed, that means whether positive or negative, being isolated, and use a different method in covering themselves. We're talking about mask, we're talking about glasses, specialist glasses, or maybe with prone ventilation, but there has not been high level of promise that this thing has been proven by World Health Organization or Public Health England or United Nations, that yes, this is the best way to treat it. These are not treatment, it's just to separate the person, maybe giving the person some temperature, keeping the person in a temperature that maybe that could be manageable, in order to see if that virus can disappear, or the person can recover by the time the immune system are able to fight. However, some of the intervention and prevention of severe acute respiratory syndrome, they call it coronavirus or COVID-19, which are somehow the same method which the Health and Social Care Organization have been using for many years. Even when we know about, if you know about Florence Nightingale, the lady with the lamb, they call it the mother of nursing. So she was one of the people who influenced Health and Social Care Organization to be engaged in the hygiene, washing of hand, and wearing disposable gloves, wiping surface, because she really used that wiping of surface to support intervention when it comes to limiting mortality rates during the army, when they were having high mortality rate in the army camp. A lot of people were dying and all that. So cleanliness is what she was actually focusing on in the health and social care. Some of the tests that most professionals use to diagnose this severe acute respiratory syndrome involve blood clotting tests, chest X-ray or chest CT scan, and a complete blood count. We also have arterial blood tests. These are some of the method, the test used to diagnose severe acute respiratory syndrome. We also have tests used to quickly identify the virus that causes severe acute respiratory syndrome, which include antibody tests for severe acute respiratory syndrome, direct isolation of severe acute respiratory virus, rapid polymerase chain. If you ask if there is a treatment for the coronavirus, at the moment, there has not been clinically approved treatment or direct treatment for respiratory syndrome, severe acute respiratory syndrome. There has not been approved clinically treatment for it. However, some of the method that is mostly common in the health and social care setting at the moment are mostly isolation, where you have both the suspected, the diagnosed, that means whether positive or negative, being isolated and use a different method in covering themselves. We're talking about mask, we're talking about glasses, specialist glasses, or maybe with prone ventilation, but there has not been high level of promise that this thing has been proven by World Health Organization or Public Health England or United Nations, that yes, this is the best way to treat it. These are not treatment, it's just to separate the person, maybe giving the person some temperature, keeping the person in a temperature that maybe that could be manageable in order to see if that virus can disappear, or the person can recover by the time the immune system are able to fight. However, some of the intervention and prevention of severe acute respiratory syndrome, they call it coronavirus or COVID-19, which are somehow the same method which the Health and Social Care Organization have been using for many years. Even when we know about, if you know about Florence Nightingale, the lady with the lamb, they call it the mother of nursing. So she was one of the people who influenced Health and Social Care Organization to be engaged in the hygiene, washing of hand, and wearing disposable gloves, wiping surface, because she had really used that wiping of surface to support intervention when it comes to limiting mortality rates during the army, when they were having high mortality rates in the army camp. A lot of people were dying and all that. So cleanliness is what she was actually focusing on in the health and social care. So now you must have heard your organization advising you wash your hand often with soap and water, or use an alcohol-based hand sanitizer, which is common in all the National Health Services organizations. So, and the majority of houses were not understanding the importance of this. But since the 2020 COVID-19 outbreak from China, a lot of people have started to understand that this thing is also good in the domestic houses, and in addition to that, this is very difficult anyway, but however, it advised don't touch your eyes, nose, or mouth with dirty hands. So it's very important when you do anything, maybe cooking, before you cook, wash your hand. When after you finish cooking, wash your hand. Before you go out from your house, wash your hand. When you're coming back home, when you get back home, wash your hand. These are very important method whereby you can also use to manage yourself from separating yourself from it, or not getting affected by this coronavirus or COVID-19. Depends on your understanding of it. Another one is wear disposable gloves. If you have contact with someone, maybe pee, poop, saliva, or other body fluid, those that work in the health and social care organizations, it's very important you wash your hand always, and then making sure if you are wearing sleeve, you fold your sleeve towards your elbow. It's very important. This thing, you wear short hand t-shirt or shirt, in order for you to be able to clean your hand properly when you are at work. As I said before, wipe surfaces like counter taps with disinfectant, and wash personal items with soap and hot water. If you are around someone with a severe acute respiratory syndrome, that is SARS, wear a surgical mask to cover your nose and mouth. This is very important in order for you not to get infected with it, or for you not to also transfer diseases to your, to your clients. Some of the advice that we also saw during the research, when Zion Extra went out to do a research on the coronavirus, what is coronavirus, and what has it been doing to people, how can we overcome it, we actually saw one simple advice from some of the bloggers, which we also put on our website. You can check our screen right now. You will be able to search directly to details of coronavirus, so that you will learn more yourself. Some of the basic blog advice is taking black pepper soup. Preventive measure, is also another preventive measure, black pepper soup. And treating the patient along with black pepper soup can actually make the patient recover quickly, but a lot of things can also happen. Drinking lots of hot water all the time, or hot tea, hot lemon tea, maybe hot water with lemon and honey or ginger, turmeric, using it to make some food. It's just like making sure you engage in more Indian cuisine, Indian food, Indian preparation, what's it called? Ancestry in making planning your food. Is also very important. You have hot pepper all the time. But if you have any advice, support for Zion Extra in regard to increase in health promotion, you are welcome. We are a Christian-based organization, but we focus on mostly health and social care awareness, because we've been sponsored by OFC Training College. So we're taking advantage of the services they provide in order for us to making sure the health and well-being of people, groups, community can be managed through availability of information and services in their community. So if you have any other strategy you want to use in helping Zion Extra in order to support in this difficult time, in this critical time of the year, or about COVID-19, you are welcome to support us in order for us to do more. We are talking about finance. We are talking about people, assets. We're talking about asset now. We're talking about manpower. So yes, we need everyone to come and support us so that we'll be able to do exactly what you want us to do in your community. So the major area Zion Extra is also focusing on is to work with different community organizations in making sure they are able to meet, discuss, plan the intervention, plan strategy in order for them to support any government in their local community or some people who stays in the diaspora who cannot actually travel home. Zion Extra can actually link you with an organization that can actually help you to do what you want to do there. This includes helping you with physical activity there and engaging with different material you want to use. Also help you with manpower at the same time. So this is what Zion Extra can also advise you, direct you, and support you with. But the most important thing, for you to do that, living in diaspora, you want to do things like that in a developing world, you will need money. So it's not that much. When we are able to connect you with other organizations that are doing them at the moment, it might be more faster, easier, and also cheaper. That is why we had to work together in order to combat this COVID-19. Thank you very much and for supporting us, and thank you very much for listening. Thank you very much for also sharing our message, especially when it comes to intervention in combating COVID-19 and making sure every individual are able to understand COVID-19, the origin, that is not just now, so that when government are creating strategy in managing the challenges we are having at the moment, they will know, these things, this is how the way it is. You make sure you have different MDT in your table to discuss it, so that there will be also clinical decision in making agreement with your community leaders and making agreement with your hospitals, care setting in your community. Zion Extra is also available because we have unlimited resources, but it's just about having the loophole to work with government that we have left.